name is Tremblay, and I am professor at the Department of Kinesiology of Université Laval. I have responsibility as teacher. I give courses of nutrition and exercise biology. I also conduct a research program oriented on the study of human obesity, being focused on the study of environmental determinants of the proneness to be overweight, and we try to deduce from these investigations potential solutions to improve prevention and treatment of obesity. The study conducted with the Roselle Institute is related to the study of the microbiota. Specifically, we were interested to verify if a probiotic supplementation having the potential to influence the gut microbiota is increasing the benefits of a weight-reducing program on body weight, body composition, some indicators of metabolic health such as insulinemia, blood lipids, and we also studied the impact on feeding behaviors as well as emotion-related behaviors. This was studied in individuals with obesity who were subjected to a weight-reducing program being supervised by a dietitian. Half of the group was receiving a supplementation, a probiotic supplementation, whereas the other half of the group received the diet supervision with a placebo. We did not see significant changes, significant differences between the placebo and the probiotic regarding the impact on body weight. However, with respect to some metabolic markers, we saw some benefits in the probiotic group, but no change in the placebo group. The highlight of the study was clearly related to the behavioral outcome of the intervention. Indeed, in the individuals, the participants receiving the probiotic, we observed beneficial changes on eating behaviors as well as emotion-related behaviors. The main innovation resulting from this study is related what we like to describe as being the gut-brain axis, the connection between the gut and the brain. And we have increasing evidence suggesting that variations in the gut profile might influence the brain and vice versa. In this regard, the observation of a benefit of probiotic supplementation on behaviors represents an indirect proof of concept, indicating that when we target the gut, there might be resulting benefits on the brain, on behaviors. The significance for the Roselle Institute and the Lallemand company is obviously an additional proof of concept demonstrating some benefits of a product that has been formulated locally. In this case, the proof is partly outside the expected focus, the initially intended hypothesis. It is more related on psychobiological effects. In my opinion, it is an important information that is concordant with the gut-brain axis concept, and that will probably open new perspectives. The next research goal is generally the testing of a product in vulnerable individuals when we have a first phase of demonstration demonstrating benefits. In the case of this study, the demonstration of potential benefits on mood behaviors being related to the probiotic supplementation opens some clinical perspectives and will probably lead us to recruit, in a subsequent phase of testing, individuals being predisposed to anxiety, displaying some stress, with the intent to verify if in these theoretically more vulnerable people there is a benefit of the probiotic supplementation, a benefit being possibly greater than what is seen in individuals not displaying any predisposition to problems. The additional thing that is meritorious to indicate is the particularity of the partnership with the Roselle Institute in the context of this study. Generally, when we perform a clinical trial, we receive the mandate to test a product under specific conditions, and we do that and we report the results that are shared with the partner. In this case, there is something else. Since the study of the global issue is shared between the two partners, we performed the clinical trial, and the Roselle Institute has taken and continues to take in charge the measurements related to the microbiota. This phase is very important since it is hoped that what will be observed in terms of bacterial variations will help us to understand what will have been found in a clinical setting. So, as usual, to better understand in order to better intervene is always a major preoccupation for our team.